My name is Dr. Rodriguez. I am a weight loss doctor in weightrx.org. Did you know that semaglutide, a glucagon-like peptide 1, GLP-1, receptor agonist, enhances adherence to healthy eating through a combination of physiological, neurological, and behavioral mechanisms. Originally developed for the treatment of type 2 diabetes, semaglutide has shown significant effectiveness in weight management, in part due to how it modifies appetite, food preferences, and psychological factors associated with eating. Here's a comprehensive look at how semaglutide supports and improves adherence to healthy eating. This increased satiety reduces the desire for unnecessary snacking or overeating, making it easier for individuals to stick to portion-controlled, nutrient-dense meals. With less hunger-driven impulsivity, patients are more likely to follow a structured meal plan centered on whole foods rather than reaching for high-calorie, processed options. Semaglutide also influences the reward-related areas of the brain, including the mesolimbic dopamine system. These brain circuits are heavily involved in food cravings and the desire for high-fat, high-sugar foods. Studies have shown that individuals taking semaglutide report a reduced preference for energy-dense, unhealthy food items and an increased interest in healthier alternatives like fruits, vegetables, and lean proteins. By reducing the reward response to palatable junk foods, semaglutide decreases emotional and hedonic eating. This shift in food preference plays a crucial role in sustaining a nutritious diet and long-term adherence to healthier eating habits. Semaglutide tends to induce rapid and noticeable weight loss in the early stages of treatment. This initial success can serve as a powerful motivator for patients to continue making positive dietary choices. When individuals see tangible results from their efforts, such as lower body weight, reduced waist circumference, and improved energy, they're more likely to stick to the dietary guidelines provided by healthcare providers. The visual and physical reinforcement of progress helps cultivate a sense of accountability and self-efficacy, both of which are key psychological drivers in maintaining a healthy diet. A significant challenge for individuals trying to adopt healthier eating patterns is the constant mental chatter or food noise that revolves around thinking about food, planning the next meal, or battling cravings. Semaglutide reduces this internal noise by blunting hunger cues and lessening the frequency of intrusive food-related thoughts. With a quieter mind, patients often report feeling more in control of their eating behavior. They are better able to plan meals in advance, practice mindful eating, and respond to internal cues of hunger and fullness, all of which contribute to healthier food choices and adherence to dietary goals. Semaglutide helps stabilize blood sugar levels by stimulating insulin release and suppressing glucagon secretion when glucose levels are elevated. This glycemic control minimizes blood sugar spikes and crashes that often lead to cravings for sugary or high-carbohydrate foods. Stable blood glucose levels promote sustained energy throughout the day and reduce the biological impulse to reach for quick-fix energy sources. As a result, patients find it easier to avoid processed foods and follow a diet rich in complex carbohydrates, fiber, lean protein, and healthy fats. Semaglutide is often prescribed as part of a comprehensive weight management plan, which includes medical supervision, nutrition counseling, and lifestyle coaching. This integrated approach provides patients with the tools, education, and emotional support needed to make lasting dietary changes. The medication enhances the effectiveness of these programs by making it biologically easier to follow recommended eating plans. In other words, patients aren't simply relying on willpower alone, they have pharmacological assistance that aligns with their health goals, making dietary compliance more achievable and sustainable. There is growing evidence that semaglutide may have indirect benefits on mood and emotional regulation. By improving metabolic health, reducing fatigue, and enhancing sleep as weight decreases, semaglutide may help diminish the tendency to eat in response to stress, sadness, or boredom. When emotional eating is less prevalent, patients are more likely to follow a nutrition plan based on hunger and nourishment, not emotion. This alignment with healthy eating patterns creates a positive feedback loop where better food choices support improved mental and physical health, which in turn supports continued adherence.
For more information on this topic, please subscribe to our channel or text our clinic number. Brought to you by weightrx.org.